Today we continue with the cell wall synthesis inhibitor drugs. At last lecture we talked about penicillins. Today we talk about cephalosporin. Cephalosporin, a semi-synthetic drug. They contain beta-lactam ring in their structure. They have the same structure and function and mechanism of action of penicillins, but it more resists to beta-lactamase-producing microorganism. هنا بهاي الحالة إنه بدنا نقول same mechanism of action، يعني بالامتحان ما نكتب إنه same mechanism of action of penicillin، المفروض نحكي نفس الميكانيزم اللي حكينا عنها بالمحاضرة السابقة اللي هي للبنسلين. Third generation includes cephaloxane, cefadroxil, cefazolin. الاسم التجاري cephaloxane هو الكفلكس used in pharyngitis, while cefazolin is effective for orthopedic surgery because it has ability to penetrate bone. This slide shows the spectrum of first generation. It's effective against Staph, Strep, anaerobic streptococci, E.coli, Klebsiella, and Proteus. Second generation is has weak effect against gram-positive cocci. It includes cefotitan, cefuroxime sodium, which used or effective in acquired pneumonia and septicemia, while cefuroxime axital effective against beta-lactamase-producing microorganism. Cefoxitin effective against gram-negative bacteria. This slide shows the microorganism which affected by second generation, and we see there is no gram-positive bacteria. Third generation is very important. It includes many drugs. Some of them are ceftriaxone, cefotaxime, الاسم التجاري اللي هو الكلافوران, ceftazidime, cefixime, and other. They very effective against gram-negative bacilli, Neisseria gonorrhea, enteric microorganism, and serratia. Ceftriaxone and cefotaxime are first choice for meningitis. بعض الأسئلة تجي إنه نريد الدرج اوف تشويس للحالة، يعني احنا اكو اكثر من دراج ممكن تشتغل بس عندنا very effective نسميها الدراج اوف تشويس. فللمننجايتس الدراج اوف تشويس هو السيفترياكزون او السيفوتاكسين. Also used in neonatal and childhood meningitis. Ceftazidime act against Pseudomonas aeruginosa. Ceftriaxone, it is effective against genital, anal, and pharyngeal penicillin-resistant Neisseria gonorrhea. It has long half-life, so it permits once daily, excreted through the bile. Third generation include one drug, cefepime. It effective against Strep and Staph, aerobic gram-negative bacteria like E.coli, Enterobacter, Klebsiella pneumonia, Pseudomonas aeruginosa, and Pseudomonas mirabilis. Have protein binding 20%. It effective against MRSA, methicillin-resistant Staph aureus, used in treatment of complicated skin and skin structure infection, also in community-acquired pneumonia. Cephalosporin and beta-lactamase. combination سوينا بين البنسلينات ويا البيتا-لاكتاميز inhibitor. قلنا حتى نزيد السبكترم ونقلل الهيدرولايسيس بالبيتا-لاكتاميز انزيم. بالسيفالوسبورين عندنا combination بين التازوباكتام والسيفتولوزان. is available only in intravenous formulation. It's used in the treatment of resistant Enterobacteriaceae and multidrug-resistant Pseudomonas aeruginosa. Also, it have activity against some beta-lactamase producing microorganisms, but it has narrow gram-positive and very limited anaerobic activity. Second combination is between ceftolozane and avibactam, available only in intravenous formulation. Broad gram-negative activity, especially Enterobacteriaceae and Pseudomonas aeruginosa. Both of these combinations are indicated for, first, the treatment of intra-abdominal infections in combination with metronidazole اللي احنا نعرفه باسم flagyl. Second, in management of complicated urinary tract infection. There are other beta-lactam antibiotics. They contain beta-lactam ring in their structure and act on cell wall, but they are not from penicillin and not from cephalosporin. The first is carbapenem. Carbapenem includes 4 drugs. First, imipenem, which is very important. Imipenem combined with cystatin because the imipenem hydrolyzed by dehydropeptidase enzyme in kidney. So it combined with cystatin to prevent this hydrolysis by this enzyme. It's very effective against beta-lactamase producing microorganism, gram-positive negative bacteria, anaerobes, and Pseudomonas aeruginosa. It's used in septicemia, abdominal infection, and pneumonia. It is very important drug combined with cystatin to protect it from metabolism or hydrolysis by dehydropeptidase enzyme, and used in septicemia, abdominal infection, and pneumonia. Second and third drug are meropenem and doripenem. They similar to imipenem, but they not combined with cystatin because that they not metabolized by kidney enzyme. They have ability to pass cerebrospinal fluid. The fourth drug is ertapenem. It not affect Pseudomonas aeruginosa and Enterobacter species. Carbapenem with beta-lactamase inhibitor. The combination is between meropenem and vaborbactam. It's used in treatment of complicated urinary tract infection, including pyelonephritis. This combination has activity against Enterobacteriaceae. Monobactams include estrogen. It is effective against gram-negative bacteria and aerobic bacteria. Third group is beta-lactamase inhibitor. We talk about this group with penicillins, and we said it includes clavulanic acid, sulbactam, tazobactam, and there is combination between extend and anti-pseudomonal penicillin. And we said there is a beta-lactam ring in the structure of these drugs. There are 2 drugs, avibactam and vaborbactam. They also effective against beta-lactamase producing microorganism, but it not include beta-lactam ring in their structure. Other cell wall synthesis inhibitor. الدراجز اللي تكلمنا عنها سابقا هي كلها cell wall synthesis inhibitor، لكن كانت تحوي على البيتا لاكتام رينج الكيميكال ستراكشر مالتها. من الدراجز اللي ما بيها بيتا لاكتام رينج ولكن هي ايضا cell wall synthesis inhibitor عندنا الفانكومايسين. Vancomycin is time dependent bactericidal. It is effective against methicillin resistant staph, gram positive staph, Clostridia difficile, and enterococci. The mechanism of action is inhibit transglycosylation step. إذا تتذكرون synthesis of cell wall قلنا لازم عندنا peptidoglycan layer، وحتى يتكون peptidoglycan layer لازم عندي precursor اللي يشمل لي N-acetylmuramic acid and N-acetylglucosamine، لازم يرتبط بprecursor ثاني ببوند نسميه glycosidic bond بعملية transglycosylation. الفانكومايسين يمنع تكوين الجلايكوسيديك بوند بين التو بريكورسر، وبالتالي ما عندي اللاير الوحدة من البيبتيدوغلايكان. من ميزات الفانكومايسين انه poor absorbed after oral administration, so it can be used in management of Clostridia difficile. الكلوستريديا difficile من الدرجة المقاومة للعلاج، وبما انه الفانكومايسين absorption مالته كلش بطيء، فيبقى بالانتستين او بالكولون لفترة اطول، فيكون in contact with Clostridia، فممكن يستخدموه بالعلاج الكلوستريديا difficile. Uses of vancomycin in patient with skin and soft tissue infection, infective endocarditis, nosocomial pneumonia. Lipoglycopeptides include tilivancin, oritavancin, and dalbavancin. They are effective against gram-positive, staph, and strep, also against enterococci. It's more active than vancomycin. The use of tilivancin in clinical may be limited because its adverse effect. Daptomycin, concentration-dependent bactericidal, alternative to vancomycin or linezolid for treating infections caused by resistant gram-positive bacteria. Daptomycin is dosed once daily intravenously. It's used in complicated skin and skin structure infections, also in bacteremia caused by Staph aureus. Daptomycin inactivated by pulmonary surfactant, thus it should never be used in the treatment of pneumonia. Fosfomycin blocks cell wall synthesis, indicated for urinary tract infection. Polymyxin, we call it detergent, it has a detergent-like effect. It's the only drug that the mechanism of action on cell membrane. It binds to phospholipid of cell membrane of gram-negative bacteria. It includes polymyxin B and polymyxin E. Polymyxins mechanism of action: bind to phospholipids of cell membrane of gram-negative bacteria, so it's cell membrane synthesis inhibitor. It has detergent-like effect that disrupts cell membrane integrity, leading to leakage of cellular component and cell death. It's effective against Pseudomonas aeruginosa, E.coli, Klebsiella, and Enterobacter species. It includes polymyxin B and colistin polymyxin E. The use of these drugs has been limited due to the increased risk of nephro and neurotoxicity.